honored to be part of the 2022 3rd BBP International Multidisciplinary Research Conference. I am Pebles Ecevedo, Teacher 3 of VICENTE ANDAYA Senior National High School. I will be presenting my study entitled School-Based Management Wash in School Implementation, Resiliency, and School Performance in the Division of Roxas City. Every child has the right to quality education, which includes access to drinking water, sanitation, and hygiene, wash services while at school. Children spend a significant portion of their day at school where wash services can impact students' learning, health, and dignity, particularly for girls, that is according to UNICEF 2020. The Department of Education Wash in School program is designed to achieve learning and health outcomes of Filipino students through a comprehensive, sustainable, and scalable school 2-based wash program pursuant to the state's mandate to defend the right of children to dignity, assistance, and protection from conditions that would hamper their development. Lack of access to adequate water supply, insufficient toilet and proper hand-washing facilities, and non-practice at hygiene behavior remain key contributors to hygiene and sanitation challenges. This situation also leads to anemia, stunted growth, and higher incidence of absenteeism, which consequently impede a child's learning ability to stay in school. UNICEF correctly notes that poverty is linked directly to poor sanitation and hygiene, and has emphasized the vital role of government in breaking the cycle of poverty and ensuring access to improved drinking water and sanitation. So, the Pebles, 2009. Best practices around the world show that improving access to and use of water and sanitation facilities within school and enhancing hygiene and sanitation practices can effectively halt water and sanitation-related diseases. To address this challenge, the Department of Education had been conducting semi-annual deworming and kindergarten and elementary school children in public schools nationwide under its Integrated Health Control Program, or IHCP. In the last 6 years, it had combined deworming with daily toothbrushing and proper hand washing under one program. DepEd crafted the Wash in School policy, DepEd Order Number 10, Series of 2016, as a holistic program for personal health care and environmental sanitation through a set of standards for proper and correct health practices in schools. It goes beyond hand washing, toothbrushing, and deworming, which are the key programs in EHCP, to cover water sanitation, including food handling and preparation, hygiene, including menstrual hygiene, management, deworming, health education, and capacity building. In crafting this set of guidelines, thus, the department, in partnership with agencies and stakeholders, hopes to address the gaps in the areas of hygiene and sanitation and keep more children healthy and in school. This study aims to determine the extent of implementation of SPM wins, the level of resiliency, the school performance in the Division of Roxas City as basis for an intervention. Specifically, it sought to answer the following questions. First, what is the demographic profile of respondents in terms of age, sex, highest educational attainment, length of service, and category of school? Second, what is the extent of implementation of SPM wins in terms of, first, water access, sanitation, hygiene, health education, and deworming? Third, is there a significant difference on the extent of implementation of SPM wins as assessed by school heads, teachers according to, first, profile, dimensions, and district? Fourth, what is the level of resiliency as assessed by school heads and teachers in terms of school heads, personal competencies, social competence, family coherence, social support, personal structure, teachers, personal competence, and social structure? Fifth, is there a significant difference on the level of resiliency among school heads and teachers when grouped according to first, profile, dimensions, and district. 6. What is the level of school performance in terms of access, quality, efficiency? Is there a significant difference on the school performance when grouped according to profile, dimensions, or district? Is there a significant relationship between SBM wins implementation and level of resiliency? Or SBM wins implementation and school performance? Or level of resiliency and school performance? This study utilized the descriptive correlational method of research to describe the SBM wins implementation in terms of water, access, sanitation, hygiene, health education, and deworming. This also included the resiliency of school heads and teachers and the school performance in the division of Roxas City for the school year 2019-2020. The descriptive also includes the existence of significant differences in the dimensions, schools, and profile of the respondents. Finally, the level of correlation between the SBM wins implementation, resiliency, and the school performance of the division of Roxas City were answered and was given emphasis in this study. Research environment, this study was conducted in the division of Roxas City. The division of Roxas City is housed at Banica Roxas City, headed by Schools Division Superintendent, and together with the Assistant School Division Superintendent, it is composed of 50 schools headed by the dynamic and the strong school heads. The respondents in the study includes 50 school heads and 286 teachers. Complete enumeration was used in the study since all school heads was included to see the whole picture of the study. As for the teachers, a sampling technique was employed to set the desired number of teacher respondents. As presented in the table, out of 1,012 teachers, 286 or 28.26% were taken as sample size. 123 or 43.01% were taken from District 1, 86 or 30.07% was District 2, and 77 or 26.92% were taken from District 3. For our data gathering tools, the instruments used in the study were standardized SBM wins questionnaire tools, adapted from DepEd in order to get the status of SBM wins implementation in the division of Roxas City. Resilience Scale for Adults or RSA, adapted from Framework et al. 2003, was used to get the level of resiliency of teachers and school heads. Standard documentary analysis was employed to get the level of school performance in the division of Roxas City. The data was taken from the file of each district. For our statistical data analysis, the data gathered from the questionnaire will be tallied, tabulated, analyzed, and interpreted using the statistical package for social science software, or what we call the SPSS. Frequency, percentage, and mean will be used to describe the socio-demographic characteristics of the respondents. Statistical data analysis. T-test and one-way ANOVA will be used to determine the significant difference of the SBM wins implementation in terms of water access, sanitation, hygiene, health education, and deworming when grouped according to profile, dimensions, and district. Moreover, this will be used also to determine the significant difference in the resiliency in terms of personal competence, social support, family coherence, and personal structure when grouped according to profile, dimension, and district, as well as the school performance in terms of access, quality, and efficiency. Person R will be used to determine the relationship between SBM wins implementation, resiliency, and school performance. What are the demographic profile of the respondents in terms of age, sex, highest educational attainment, length of service, and category of school? So the respondents were 41 to 50 years old, female-dominated, bachelors with MA units, had 11 to 20 years in service, and assigned in a big school. So the public schools district supervisor, the PSDS, may encourage school heads and teachers to improve the educational attainment through enrolling and finishing master's or doctorate degree. What is the extent of implementation of SBM wins in terms of water access, sanitation, hygiene, health education, and deworming? The extent of implementation of SBM wins in terms of water access, sanitation, hygiene, deworming, and health education was very effective. So the division SBM wins focal person may conduct technical assistance quarterly to school to maintain very effective implementation of SBM wins. What is the level of resiliency as assessed by school heads and teachers in terms of personal competence, social competence, family coherence, social support, and personal structure? The level of resiliency as assessed by school heads and teachers in terms of personal competence, social competence, family coherence, social support, and personal structure was very high. So the PSDS may conduct TA sessions for school heads focusing on sustaining very high level of resiliency. The school head may consider to implement the TA agreement with the PSDS to sustain the very high level of resiliency. Is there a significant difference in the level of resiliency among school heads and teachers when grouped according to profile, dimensions, and district? A significant difference was found in the level of resiliency as assessed by school heads and teachers in terms of sex, age, highest educational attainment, and length of service, but not with the category of school. Furthermore, a significant difference was found in the level of resiliency as assessed by school heads and teachers in terms of dimension, but not with the district. So the Division Human Resource and Management, or the HRD, may conduct seminar on the sustaining resiliency of the school heads. What is the level of school performance in terms of access, quality, and efficiency? The level of school performance in terms of access and efficiency was high, while average for quality. So the PSDS may replicate best practices and innovation in quality teaching and learning to improve the school performance, particularly on quality. Is there a significant difference in the school performance when grouped according to profile, dimensions, and district? There was no significant difference in the school performance when grouped according to profile and district, but not with the dimensions. School-based management wash in school implementation is very timely this COVID-19 pandemic, so as the resiliency of the teachers. That would be all. Thank you for listening.